Hi, welcome everybody to the NeuroRhinology Advanced Rhinology Endoscopic Skull-Based Surgery Fellowship interview presentation. This is a series of 4 interview presentations that go over some of the qualities and benefits, as well as opportunities for you and during our fellowship. This one is the fellowship nuts and bolts. We also have one that highlights the clinical and surgical education, as well as an overview of our research opportunities, curriculum, done by Dr. Kimple, as well as a beginner's guide of Chapel Hill. And so without further ado, we'll continue with the nuts and bolts of our fellowship to better acquaint you with some of the details of the fellowship. So again, this provides an overview of our health center, as well as our department and the fellowship program. UNC's health main campus is located all in one site in Chapel Hill. So you see the 5 hospitals that are listed here, and all these 5 hospitals are on one site, and those are the hospitals that you will work at. So we have the Memorial Hospital, which is the oldest, number 1, to the newest, which is the Cancer Hospital. We're also building in the center portion of this area a very new and elaborate UNC surgical tower. It's due to be completed in 2024 to 2025. We'll have state-of-the-art operating rooms as well as ICUs. We also have an ambulatory surgery center that's across the street from that main hospital that I just showed you. They have 8 operating rooms where we perform the majority of our outpatient functional surgeries. We have 2 clinic locations. The furthest location is the Carolina Crossing office, and that's 4.6 miles from the hospital. And the other location is 3.4 miles at Meadowmont. These are all close to Chapel Hill. This is technically in Durham, but Durham and Chapel Hill are very, very close. And this is the Meadowmont space. We occupy the 3rd floor of this building that you see there. As with most any new and kind of updated clinical facility, we have nice facilities. We have telepacks in every rhinology room where you're able to use pediatric endoscopes, as well as the full array of clinic devices for your patients. We're also very proud to have a multidisciplinary surgical lab, which has not been too active since the onset of COVID, but we are very excited to reinitiate training opportunities in this location. There's an adjacent auditorium where we do lectures right on the other side of this room, and you can basically walk from a lecture to the surgical dissection. Now I'm going to go over just some of the history of our departments and some of the things we're proud of. My old chairman used to say that our history is very boring in the sense that we've had 3 leaders, Dr. Newton Fisher, Harold Pillsbury, and Dell Yarbrough. And so again, a lot of stability in the top, which has really helped provide our department an opportunity to educate large numbers of people. And we're very proud to have that opportunity. Our fellowship did begin in 2011, and we're proud to be into our 13th year of that. Like any big academic medical center, we have 6 clinical divisions. The one you're most interested in is obviously the rhinology, allergy, and endoscopic skull-based surgery. And that's what we're going to talk about. We are approved by and have been approved by the Rhinology Training Council of the American Rhinologic Society. This vote was in 2019, which was our first opportunity to be approved. Upon completion, you will be able to provide a certificate of completion of our fellowship, as well as the NeuroRhinology Advanced Sinus Surgery Fellowship. So we have 5 division members. We have just hired Dr. Clack Cromwell, and she will be more a year in practice by the time any of you arrive. And so Brent Sr. is our chairman. Our division chief and vice chair of clinical affairs. I'm the fellowship director. This is me, Charles Ebert, Dr. Clack Cromwell, who is coming from WashU, Brian Thorpe, who is the associate fellowship director, and then Adam Kimple, who's our Fellowship Research and Curriculum Director. Our current fellows, Dr. Chaskis and Dr. Kong, we're very proud of both of them. They will be there for you on interview day. Feel free to ask them any question that you so desire. We do understand that you have a lot of opportunities and a lot of choices to make for your upcoming career, and we want you to make the right one. And these guys have some insights that you may be interested in. So please feel free to ask them any question. We are very proud of our former fellows, and I'm proud to say that all of them have jobs doing what they wanted, and all are doing rhinology at this time. And so since our very first fellow in 2011, Dr. Gore, everyone has had very successful job opportunities. Dr. Rodriguez at Case Western, McClurg, Stan McClurg, he's a rhinologist in Kansas City. Dr. Del Senor is at Mount Sinai, Brian Thorpe is at UNC, Patrick Colley is at Montefiore, Dr. McKinney is at the University of Oklahoma, Flat Cromwell is at UNC, Dr. Schumann is in Virginia Commonwealth, Kemple at UNC, Dr. Capper is a rhinologist at Portsmouth Naval Medical Center, and the chief of otolaryngology there, Dr. Hernandez at LSU, Griffin Santorelli at the Vero in Arizona, Colby Brown at Case Western, Yelpy at Mercy Health in Cincinnati, Dr. Miller at Virginia Mason in Seattle, Justin Morse at Rhinology and Associates in ENT in Chattanooga, where he's done has a good neurosurgery partner, and he's able to perform a significant amount of skull-based surgery there. Dr. Chaskis has taken a job at current fellow at Hofstra in Long Island, and Dr. Kong, most likely, he has two opportunities, but most likely is choosing the University of Mississippi. And so again, very, very successful in placing our fellows into jobs. And so I think that's a testament of the quality of your fellowship and that of your mentors. So again, these are all fellows, these are all pictures of some of our recent fellows. This is Colby and Jelpy, and this is Justin and Craig, and this is our Mark and Albert at the State Fair eating a big turkey leg. The position that you will obtain within our department is that of clinical instructor. The salary is commensurate with a PGY 7 level, roughly 68,000, but is likely to go up by the time you get here. You will have $4,500 in discretionary fund for travel or for boards. You can use it as you see fit, but it also obviously has to be for educational purposes. You'll get the standard medical disability and malpractice insurances. You get 3 weeks of vacation for the year, 15 days, plus a week around the holiday that does not count for that time. Will provide you ability and support you to present in any research meeting nationally that you so desire. And so again, our interest is in you to be successful. And so whatever we need to do to make that happen is what we're here for. The structure of the fellowship is basically the year is divided into 1 month rotations. You have 2 services, a skull-based and a functional service. Both services perform a little bit of each thing. It's for example, if you're on the skull-based service, you will also do functional cases. And if you're on the functional service, you will also do skull-based cases. So there's a bunch of cross-contamination or pollination, as you could say. Dr. Cromwell and Thorpe will be the skull-based team. Dr. Skimple, myself, and senior will be the functional team. We roughly spend approximately 2 days in clinic per week and 3 days in the OR, but it varies a little bit by service. Some days, some weeks it's more, some days less. Fellow clinic, which you both have on Wednesdays, will be in the afternoon. I think that's a great opportunity for learning, especially seeing the longitudinal care of patients that you work up and operate on and then take care of post-operatively. So I think it's a good opportunity to put into practice some of the things you're learning, both from a clinical standpoint and from a surgical standpoint. Your fellow OR, generally the ORs are scheduled with faculty members, and this will be as your schedule dictates. For example, if you have a patient that needs surgery, you'll pick a faculty member that you want to do the surgery with, and we're always welcome to do that with you. Call, for the most part, you have 3 to 5 days per month, usually 1 weekend per month and some scattered weekdays, but you always have faculty backup. And so, and call is general call within the department. Again, your faculty backup will be one of the rhinology faculty for the most part, which is someone you know and someone you work with routinely. We're also very proud to offer a very diverse allergy practice. We have 2 full-time allergy nurses. We have a large number of patients on immunotherapy. Again, opportunity for that experience. A very robust allergy practice at our Meadowmont office. We have lots of opportunities for fellowship. I encourage you to watch Dr. Temple's presentation on the research curriculum and opportunities. It gives a nice overview of what's been going on from a teamwork standpoint, as well as within our labs, and as well as our research curriculum. We also have other opportunities for education. There's Southern States Rhinology, which we go to every year. We have weekly rhinology conferences, as well as research meetings. We invite lecturers across the US and abroad to present topics of interest to these rhinology conferences. I think that's a unique opportunity. We are available and generally prepare board cases and seminars to prepare you for your oral boards, as well as endoscopic courses for the neurosurgery residents. And again, we hope to expand that to do more of a local and regional endoscopic course in the future. So I think the advantages of UNC, you get a full range of experiences, allows you opportunities to learn from the complex and diverse practices. We have a great team with lots of different approaches for functional cases. We have a large allergy practice, lots and lots of endonasal procedures, expanded endonasal procedures. We have excellent collaboration with the pulmonary colleagues, rheumatology, ophthalmology, and neurosurgery, as well as pediatrics. So I think this really provides an excellence, breadth of excellence in both patient care, research, and education. And I think it'll be difficult to find any others as good. So again, feel free to ask any questions during your interview day, and we're very thankful that you've decided to interview with us. Please look in the mail, because we have sent you all a very nice kind of care package that I hope to get you to think a little bit more about UNC. Again, thank you, and look forward to meeting you. Please follow us on Twitter if you're interested. Again, thank you so much for interviewing with us.